Hello, and thank you very much for joining this targeted oncology presentation entitled Advancing Survival in Relapsing and Refractory Multiple Myeloma. In recent years, the treatment for heavily pretreated relapsed and refractory multiple myeloma has evolved to include multiple new effective treatment options for second and subsequent lines of therapy. And today we're going to talk about a novel therapeutic target for treatment, specifically exportin-1 or XPO1, and in fact, the first selective nuclear export inhibitor to enter clinical use for patients who have developed relapsed and refractory myeloma after both immunomodulatory and proteasome inhibitor-based therapies, as well as exposure to CD38 monoclonal antibodies. Now, my name is Dr. Paul Richardson from the Dana-Farber Cancer Institute in Boston, Massachusetts, and I serve as the Director of Clinical Research and as the clinical program leader. And it's really my privilege and pleasure to welcome today, joining me, Dr. Cristina Gasparetto, who serves as the director of the myeloma program at the Duke University Medical Center in Durham, North Carolina. And in that context, it's my real pleasure to welcome Cristina and to thank you so much for joining us. So please, let's begin.
Thank you, Paul.
It's my pleasure, Cristina. So as we discussed before, Cristina, in terms of our discussion outline, there are a few things we need to cover. And if I may, Cristina, I wanted to start by asking for your thoughts on the rationale for treating with a nuclear export inhibitor in relapsed refractory multiple myeloma.
As you know, I mean, in the relapse setting, the number of patients who are penta-exposed, triple refractory is increasing, unfortunately. And so we need different targets. We definitely need to attack the myeloma at different level. And so selinexor is a new agent attacking the myeloma differently. So it's an inhibitor of exportin-1, which is a very important protein overexpressed in many cancer cells, overexpressed in myeloma. In fact, the overexpression of this protein correlates with poor prognosis in myeloma. And selinexor blocks these proteins, and this protein, just to talk briefly about the mechanism of action, this protein carries out of the nucleus what we call the cargos, right? Tumor suppressor or oncoprotein, and carries out these cargos out of the nucleus to the cytoplasm, and the cells don't die. They keep proliferating. So selinexor blocks these proteins, so the cargos doesn't leave the nucleus, and eventually cells go in apoptosis. So it's a different mechanism of action. We didn't have these targets before in myeloma, so it's definitely new and very interesting.
No, I agree, and I've heard a description of this, which I've developed in my own way to sort of provide a metaphor for my patients as to how we describe this. It's basically as if within the nucleus of the cancer cell, and this is analogous to the home, there's a rave going on, and the parents have left the house. And essentially what basically happens is by blocking the departure of the parents, not only do the parents stay at home and convert the rave to a much more civilized wine and cheese, but at the same time, and this is actually just as important, it blocks the social media that the kids are using to invite other people to join the rave, because of course it's not simply just the retention of tumor suppressor proteins, but as you pointed out so nicely, Cristina, it's the inhibition of key cargo proteins that then move out into the cytosol and can control further proliferation, survival, and growth. So I absolutely agree with you. It's a fascinating and novel mechanism, very important in myeloma biology.